Yeah, in general, women experience distinct biological and gender risks across the lifespan, specifically around pregnancy, when we see adverse pregnancy outcomes such as hypertensive pregnancy disorders like preeclampsia, eclampsia, or gestational diabetes, as well as during the midlife when we see menopause-related cardiometabolic and vascular changes. And those do have effect on stroke risk, in addition to traditional stroke risks such as atrial fibrillation, hypertension, diabetes, that do have much high prevalence and perhaps higher impact on stroke risk. And if you add gender social roles to this, caregivers, as well as social determinants of health that also affect what we call health-seeking behavior, adherence to prevention, and then we talk about delays in assessment and inequities in access to care and outcomes. So really, when we talk about, women and stroke, we see a lot of under information. So women have low health literacy, they're under investigated, they're underdiagnosed, and perhaps undertreated. And same in the recovery, there is a disproportionate burden of women where they have greater disability, higher likelihood of long-term care placements, and gender barriers to intensive rehabilitation. And post-stroke trajectories are also impacted. So really, Genesis was established as a forefront of World Stroke Organization committee that is focused on addressing these sex and gender-related disparities in stroke incidence, treatment, and outcome. And we hope, with very inclusive geographic representation from all countries, that will be able to provide the networks, mentorship opportunities, advocate for policy changes, and promote inclusion in education research, as well as clinical and leadership practices.